Hi, I'm Imani Walker, and three things that have helped me to get well are my faith, a comprehensive program that I went through that was specifically designed for mothers, and a loving, supportive family. So I feel that I was blessed to have all of those three things, and that by the grace of God, I finally found appropriate health care. And so my message is I'm a mother of 4 children, and after 11 years of marriage, I was divorced. And my mom passed around that same time, so I was very depressed. I didn't know I was depressed, I just knew I needed help. I knew I was in more pain than I had ever experienced, and I thought that through sheer faith and grit that I would be able to turn my situation around, and things just spiraled down for me. And it wasn't until I was able to access a program that was comprehensive in nature. It was for co-occurring mental health disorders and addiction that I finally was able to get some help. I was in a space where it was all women, it was all mothers, so it was gender specific and trauma informed. I didn't know anything about those kinds of terms. I just knew that it was really helpful to be in a room with other women that I could identify with. I felt safe, that I could talk about the trauma I had experienced in the marriage. I finally grieve. I had not been able to grieve because I was so busy trying to keep all the balls in the air and still be a mom. And it was long-term in length, and that was good for me. It was in the community, so I was able to take care of my children, go there during the day, so that was very important. My dad was still alive at that time, and so my father was a great support system. Economically, I would not have been able to survive if it was not for my dad. So obviously, I'm very grateful for those kinds of natural supports that I had. But my father isn't a behavioral health specialist, so with all the love and financial support he provided me, if I had not accessed that comprehensive care that I did, I'm not sure that I would have been able to achieve any healing. So I'm very grateful that that was in place for me. Since that time, what I've learned is that the only way to overcome the stigma of behavioral health issues, whether it's the mental disorder or the addiction, for me, and I'm not saying that everyone has to do this, but I turned to advocacy. I found that when I got up and spoke my truth, even though sometimes I literally was shaking in my boots, like literally just scared to death, afterwards I felt empowered. I felt empowered. I felt like I made a difference. I went on, I started from the very beginning, just within the community, speaking up, and then from there, I did some national work and then some international work. And I find that giving back is so important, and for me, it was important for me to what I call being on the front line, which is the peer work that I do. I work with vulnerable mothers who have come to the attention of the child welfare system. So I'm helping families who are very similar to my family. So whether it's that, helping those moms, or I'm from Washington, D.C., so whether it's that or going over to Capitol Hill and talking to policymakers, I just feel it's very rewarding to be able to make an impact on both levels.